Maxine Fothergill from Amax Estates and Property Services in Gravesend. We specialise in sales, lettings and block management, and we're open for business. To find out more about us, please visit our website on www.amaxestates.com.
So today I'm honoured and privileged to have Elliott Reid, who's joined us. Elliot is an osteopath, he's a personal trainer, and he's also the local director of Revitalize Clinic. So thank you for coming in today, Elliot.
My pleasure, Maxine. Nice to see you.
Thank you. Got a few questions
that
I'd like to ask you today, so that you can tell people about your business and what you do. So first of all, what is an osteopath?
The easiest way to answer that is because we are healthcare practitioners. We mainly see people who are suffering from what you would call musculoskeletal pain, so pain relating to joints, muscles, ligaments, etc. Now, our intention is the same as other healthcare practitioners, which is to enable someone to become pain-free. However, how we do that, it probably separates us from other healthcare practitioners. So we're not as disease-focused as you might find more traditional medical practitioners. Our intention is to make sure that the mind, the body, and the spirit have enough to combat what that person is presenting with by themselves. One of our principles is that the body has its own medicine chest. So for example, rather than you go to a doctor where the doctor would just prescribe you anti-inflammatories and painkillers, we would look into the function of that joint or muscle. Does it have the capacity to do with what you want it to do on a day-to-day basis? Is that person mentally well? Is there social support system there to help them to recover from a certain injury? So essentially it would look like you'd have a longer consultation with us, about 10 to 15 minutes. We then spend our time diagnosing the injury, and then we'd have a look at how we can increase that tissue's capacity through exercises and give you advice to rest that area. But then as well as that, provide treatment which might consist of massage, manipulation, acupuncture, whichever is needed. But it's generally a more holistic, more patient-centered approach to getting our patients pain-free.
Sounds interesting.
Good
Yeah,
stuff.
definitely holistic.
It's interesting
approach.
to me.
So why did you choose to become one?
I've always been interested in health, probably since the age of 8 or 9. I can remember reading big books on health, big books on psychology. I've always been interested in how the body and the mind can become stronger, fitter, faster. But when I was 15 or 16, I suffered from a back injury when I was trying to get fit for when I was trying to compete that weekend in a boxing match. And I went to see an osteopath. My mum was kind enough to take me, and he was able to get me fixed up within 3 days, ready for the fight. So that planted the seed. But then what really made me more holistically focused was when I had, unfortunately, a couple of friends pass when I was 17 and 19. They passed from cancer. And they were 17 and 19. And it really reinstated to me the fact that we've got one vehicle of life, and that's our health. We are only going to go as far as our health will take us.
Yes.
So that's why when I started up the Revitalize Clinic, I wanted to make sure that we are helping people to unburden themselves from mental illness, from pain, from poor physical fitness, so they can live the life that they want to live.
So really it was from like that kind of your own experiences that really drove you to the profession you're in now?
Yeah, I would say that is a lot of, everything which I do is based on the empathy that I have for individuals who can't do certain things that I would want to do, or from where I've experienced a loss or a burden I want to then relieve other people of.
Excellent. So what qualifications do you need to be an osteopath?
So to gain access into the course, preferentially you would have at least 2 sciences in A-levels, but you can do a year access course. But after that, you have to do at least a 4-year master's. Sometimes it can be 5 or 6 with the access course and then with the part-time course, but you at least need a full-time master's degree to study osteopathy.
Yeah, so it's
Or to practice osteopathy.
It's quite a lot of research and everything to be able to just do this. So it's
Or to practice osteopathy.
It's quite a lot of research and everything to be able to just do this.
And I have to say, we had, I think, in our we had about 20 to 30 hours a week of contact time studying. Then you have to study on the side. Then you have to do at least must be at least 16 to 24 hours of clinic as well. So, and everything that I've learned at university I've applied, so it's not like it was empty knowledge.
Yeah, yeah, excellent. So, well, that's good, and that
It's
certainly
handy.
is. Yeah, definitely. So, what kinds of pain or conditions do you actually treat?
Well, a lot. So today I saw a joint irritation to the lower back with associated nerve pain, or sciatica you might call it.
Yeah.
Quite
Common, that one, isn't it?
very common.
Yeah.
Treated as well as that. I've had a patient for temporomandibular joint pain, so jaw pain.
Really?
Ankle pain.
How do you deal with the jaw pain?
Jaw, it depends really. So I'll give you an example of this patient. It's going through and this brings into what we discuss as to what osteopaths do, right? So on the surface, just jaw pain, you've got a muscle called masseter here, temporalis here. Both those areas provided trigger points or areas of pain, right? She also had a limited ability to open her mouth, which means that those those muscles are shortened.
Yeah.
But she's also going through an extremely stressful period of her life, and whenever we're stressed, we tend to group down, right? So treating her jaw for pain relief was one. Giving her exercises to increase the length of the muscles in her jaw was another. Having a discussion with her, which enabled her to realise that her stress is probably more of a factor in this presentation than she previously thought, then allows her to start to walk down that path of understanding and exploration of how her stress might be a factor in how she can reduce it. But then, as well as that, giving her methods, so you could call them psychosomatic techniques to use her mind, or calming her mind, then calm the muscles in the jaw was also a thing that we had to do. And the last were to improve her sleep. When we're sleep deprived, we don't tend to deal with stress as well. So improving her quality of sleep with nighttime routines, with certain herbs that she can take before she goes to sleep. These have all helped her to become, I think, after her first treatment, she was about 60% better. So
really?
Yeah, and she's had it for over a year, so I'm excited to see how she's going.
I bet. That's really exciting. That's really good. So tell us a bit about your business. When did it open, and what services do you actually offer? Yeah,
so we very much cater to the biopsychosocial, so the body, the mind, and in multiple ways, and obviously social circles as well. So we have our pain clinic, where we have a team of, I think, 5 pain clinicians who help people to become pain-free. We've got a team of 4 personal trainers who help people to become physically fit in our private fitness studio. We've got our mental health clinic as well, where we have counselling and life coaching, and then we've got our herbal medicine as well.
Okay, so you really do cover absolutely everything, head to toe.
Try to.
That's great. And I understand you were elected as counsel for the Institute of Osteopathy last year.
Yeah.
So congratulations on that. That's brilliant. So tell us a little bit about what does that actually involve?
My main anyway, we've helped over, as at Revitalize, we've helped over 8,000 people so far become pain-free, mentally well, physically fit. And we're quite a large practice, so we see 800 to 1,000 appointments a month. And that's partly due to my focus on making sure that we're effective, but also I do like marketing, and I feel that was something that I could bring to the council, so and to osteopaths in general. So I pitched my skill set to try and improve the evidence base utilised within osteopathy, but as well as that, to improve how many people have heard of osteopathy. So I pitched that to the osteopathic community, and they then thought that was a good thing to do, so they elected me. And there's a few really exciting things that we're working on at the moment. So we're working on being able to reach more people through marketing. But one thing which I'm quite passionate about is, you mentioned how, when you highlighted that it's quite a long 4 years to study to be an osteopath. So one thing that we're looking at doing at the moment is seeing if we can get fourth year students, final year students, paid placements whilst they study. So then, they can earn whilst they study, but as well as that, it means that practitioners like myself, can start to recruit osteopaths a lot easier. Because, and
of course, you might be able to, even if your business is growing, keep them on.
That's the intention. So one thing that we're doing at the moment at the clinic is we're taking on final year students and mentoring them, so that then allows us to recruit more osteopaths each year, and they get the benefit of it from mentorship, and one's come on board as a sports massage therapist, so she gets paid at the same time. So it's essentially everything that I found beneficial to work in Gravesend with Revitalize. I'm just trying to scale that up nationally throughout the council.
That's That's excellent.
Thank
Well
you.
done. Sounds
Cheers.
really exciting.
Cheers.
You're also founder of the Black History School.
Yeah.
What is that? Tell us a little bit about that.
Yeah, so the Black History School is, if I could summarise, it's very difficult for people to step into a path or walk a path which they haven't seen people like themselves walk before, right? And I think the issue with Britain and with the descendants of the Commonwealth who live in Britain is there's a little bit of a dichotomy going on, because you've got the history which a lot of English children are taught, which is, for the lack of a better term, probably sugar-coated, and then and then you've got the history which isn't taught to those descendants of the Commonwealth. So my family are from Jamaica, right? Now, when I grew up, I was called the M word on a very regular basis. I was kicked out of parties. I was taken outside of multiple parties for a kicking just because of how I looked, and it doesn't build the right esteem in a child. So when I did my own research and I did my own took my own lessons in Black history or African history, I found that Africa and people of African descent have a huge wealth of history which we're not taught. So with the Black History School, it is there to educate the diaspora of the history which is rightfully ours, but as well as that, to make sure that everyone is well educated on the fact that the reason why human beings have gone from being hunter-gatherers to now enjoying the modern luxuries that we enjoy today, whether that is medicine, schooling, education, architecture, building, it's come from a very much a multicultural, multi-ethnic and multinational effort. And it's just making sure that people are educated on the African side of things. But what I'm working on at the moment is I've written a 50-page script for a graphic novel, and that's going to explore different areas of history, and it's going to be there for any child, especially child of the West African diaspora, to learn more about their history in a graphic novel format. So it's easy to digest, it's full of metaphors, it's full of lessons, and yeah, I'm just pitching that to agencies at the moment, so we'll see how it goes.
That sounds brilliant, because I think one of the things is that you must never forget where you come from, your cultural background.
Absolutely.
So you doing that is wonderful.
Thank you,
really
appreciate
good. On a final question, what advice would you give somebody who is thinking about opening a business?
Yes, if I could come up with a metaphor, I think a lot of people who I speak to try to open up businesses, they think they have to go all in. So they think that they have to quit their job, or they have to spend all the money that they've saved on a business. And the way that I would see that, coming from a boxing background, be the equivalent of you walking into the hardest fight of your life and thinking that you're going to flatten the person in front of you with one big right hook. It's not going to work out. So or it very rarely works out. So what I would advise is to, first of all, diversify your risk. So to say that you're going to try to make these things work with a certain amount of money, leaving some behind for yourself, and to experiment to see which works and what's the best method to make each one work. As well as I would research thoroughly, and I would really balance your optimism and your pessimism. So all business owners or entrepreneurs, I think by nature, tend to be quite optimistic, tend to hope for the best, which is great, but it never really it's just not a clear-cut path. So I would encourage people who are overly optimistic to also learn to use their pessimistic side, learn about the risk that they're going to encounter and the flaws in their plan. I would test with variable overheads before you test with fixed overheads. So before you sign a long lease, before you take on employees, work with variable risks like your marketing, like your, I suppose you could say, your own time rather than other people's time. And once you've got something that can work with a minimal viable product, so something which is easy to put out but gets good results, then you're probably onto a winner. If you need all of your money to make it work, then it's probably not the best thing for you to do.
Yeah, excellent advice. So thank you, Elliot, so much. I mean, that's some great advice. I think that we all learned a lot today about being an osteopath, about running a business, and about Black history. So I really appreciate your time.
My pleasure. Thank you so much for taking the time to talk to me.
Thank you, and thank you for coming along.
My pleasure.